I just want to introduce the director of the Office of Public Engagement, in which this event is being hosted through a part of our Black History Month series, and that is Congressman Cedric Richmond, who is just joined us as well.
Well, let me just really thank everybody for your time today and for joining us on something that's so important. When we think of Black History Month, generally we think about all of those first and all of those pioneers and all of those elders that gave their blood, sweat, and tears so that we could do the amazing things that we've been able to accomplish in our life, and that we could make this a more perfect union. But too often, we don't talk about things that are affecting us now, ways to pave way for the next generation, way to make health outcomes and lives better in the future. And I think that that's why this gathering is so important. And I think it's so appropriate to be doing during Black History Month. So it's exciting to kick off today's event, Cancer in Color, Equitable Care for Our Communities. We know that cancer is a disease that has hit the Black community particularly hard. Black Americans have the highest death rate and shortest survival of any racial ethnic group in the United States for most cancers. For Black people, Black women are 41% more likely to die from breast cancer than white women, despite lower incidence of the disease. And I just have to publicly say that I am very fortunate that my mother is a 24-year breast cancer survivor. And that's because of early detection. She was a public school teacher and had health care. And all of those things are important. And so my family, we consider ourselves considerably blessed, but that's not the case for too many of our African-American families. And that's what we're here to talk about today. Now, for my Black brothers, who are 1.8 times more likely to be diagnosed with and 2.2 times more likely to die from prostate cancer than white men, that is something we have to talk about. That is an awareness and a issue that we really have to collectively get behind. But that's why we're gathered here today, to raise that awareness to all of those problems, but also to talk about the solutions. This administration has committed to making significant progress in ending cancer as we know it. We plan to reduce the cancer death rate by at least 50% over the next 25 years and improve the experience of living with and surviving cancer. And we'll do that by intentionally working to close the gaps we see in access to screening, treatment, and care. So while the original cancer moonshot led by the president in his role as vice president transformed the federal government's approach to tackling cancer, we know our work is far from over. That's why we're so proud to reignite the cancer moonshot. It will build on a quarter century of bipartisan support, public health progress, and scientific advances by mobilizing a whole government approach to addressing cancer. And this administration knows this work is important. And for many of us, it's personal. You heard my story. We all know the president's story. And today you're going to hear from my administration colleagues on the work we're doing to change the trajectory of what cancer looks like in this country. You also hear from some of our most trusted partners, those helping drive the science behind treatment and detection, research, and those leading the way on public education and advocacy. And I want to just thank those, especially when we talk about the public education and advocacy. Being a trusted voice, I believe, has significant responsibility. Being an influencer has significant responsibility, and especially to the Black community where cancer is disproportionately wreaking havoc and creating trauma and pain throughout that community. I think those of us that have voices, it's important for us to lend those voices. So now let's get the program started. I'd like to introduce Dr. Kimberly Jeffries Leonard. Dr. Leonard is the president of the Links Incorporated and vice chair of the American Cancer Society's Cancer Action Network Board. She also has over 25 years of experience in health promotion and disease prevention. So with that, thank you, Dr. Leonard, for joining us, and I'll turn things over to you.
Hello, and welcome today to our forum titled Cancer in Color, Equitable Care for Our Communities. This morning, we will be joined by various leaders and advocates who will hit on our administration's commitment to racial equity at the center of its health policy initiatives and actions on cancer treatment, prevention, and research. With that being said, our first panel is When Cancer Has Color and Gender, and it will be moderated by Dr. Kimberly Jeffries Lanier, President of the Links Incorporated. And without further ado, over to you, Dr. Kimberly Jeffries Lanier.
Thank you so much, and welcome to Cancer in Color. This panel is our forum about cancer has color and gender. I'm so very honored to be able to moderate this forum because, you know, cancer is personal. There is not one of us who has not been touched by cancer. Either we know someone who has had cancer, one of us has cancer, we're a survivor, or we've lost someone way too soon to cancer. I personally lost my grandfather and my oldest brother to cancer. And what we want to be able to do is shed light on those cancers and those things that we can do, especially in light of the fact that we are now relaunching Moonshot, to talk about what we as communities of African descent need to know. We have a powerhouse panel this morning. I'm so pleased to be able to introduce LaToya Hill of the Kaiser Family Foundation. She is a senior policy analyst with Kaiser Family Foundation's Racial Equity and Health Policy Program. In this role, she conducts research and analysis on projects related to the intersection of racism and discrimination, social and economic inequities, and health. She's held many roles, and she's also worked in state health departments as an epidemiologist, where she's also focused on racial disparities in maternal and infant outcomes. We also have Dr. Carol Brown of Memorial Sloan Kettering Cancer Center. She is a board certified gynecologic oncologist who is the Senior Vice President and Chief Health Equity Officer at the Memorial Sloan Kettering Cancer Center and the incumbent of the Nichols Biondi Chair for Health Equity. She serves as Vice Chair of Health Equity in the Department of Surgery. She holds many academic appointments, but her career has been focused in 3 areas: providing high quality and compassionate surgical care to women with gynecologic cancer, wiping out cancer health disparities, and promoting public policy to increase awareness, improve care, and increase research funding for gynecologic and other cancers. We're also pleased to welcome to the virtual stage a history-making administrator, Chiquita Brooks LaSure. Her historic appointment and confirmation as the first Black woman to lead the Centers for Medicaid and Medicare and Medicaid Services is very timely that we have her here in Black History Month. She is an American healthcare policy official, and she started her career as a program examiner and lead Medicaid analyst in the Office of Management and Budget. She also worked as a staffer for Democratic members in the United States House Committee on Ways and Means before joining the Center for Consumer Information and Insurance Oversight, where she was tasked with managing policy related to the Affordable Care Act. Welcome, ladies, and thank you for joining today. So let's start with you, LaToya. Give us the landscape about what cancer looks like in color and in gender.
Thank you, Dr. Jeffrey Leonard, and it's an honor to be included in today's discussion. I also want to thank Congressman Cedric Richmond and the White House Office of Public Engagement for putting this event together and taking the time to not only celebrate the contributions and successes of Black people in American society, but also give the space to have the discussion to ensure the translation of these successes into all aspects of the Black experience, including to improve health equity. I want to begin with a quick overview on the status of disparities in cancer outcomes, screenings, and treatment as we think about equitable care in cancer for our communities. And I have a few quick slides that I'm going to briefly go over. So cancer remains the second leading cause of death in both men and women nationally, causing 1 in every 4 deaths. And this is withstanding the recent rise of COVID-19 to one of the leading causes of death. And while cancer impacts people of all backgrounds, it doesn't always affect them equally. So even as we see improvements in cancer incidence and mortality rates over time, racial disparities in cancer outcomes persist. And these disparities have been recognized, and we know they are driven by underlying structural, economic, and socio-environmental factors outside of the healthcare system that are rooted in racism and discrimination. Today, I'll be discussing these disparities primarily through a racial lens and how it impacts the Black community. But I think it's also important for us to take some time to recognize that they occur through a broad range of dimensions, which often intersect with each other, including socioeconomic status, gender, geography, sexual orientation, and other characteristics. The findings we'll discuss today are based on an analysis of national data and a review of the published literature. So when we look across all cancers, the rate of new diagnoses declined for all races and ethnicities between 2013 and 18, with Black people experiencing one of the larger declines, which closed the gap in overall cancer incidence. This resulted in a rate of new cancer being lower for Black people than for white people in 2018. However, Black people still had the highest incidence rates for some cancer types. So as we see, Black people have the second highest rates of all new cancers combined, but when we look at some of the more common cancer types, what we find is that Black people had the highest rates of new colon and rectum cancer and prostate cancer in 2018. And so despite the decline that we saw in the rate of new cases from 2013, we see that the disparity persists for these two cancer types. As we look across cancer deaths, we find that among all cancer deaths, the rates have declined for all races and ethnicities between 2013 and 18. And we see the largest decline occurring among Black people, such that the gap in overall cancer death rate for Black and white people actually narrowed. Despite this decline over time and the narrowing of the gap, Black people had the highest rates of cancer death compared to all other racial ethnic groups. And this is despite having lower rates. I apologize. Am I on the? Okay, I'm sorry for that. The technical difficulties in this Zoom space. But just to reiterate, as we look across all cancer deaths, we find that despite the decline over time and narrowing of the gap, Black people had the highest rates of cancer death compared to all other racial and ethnic groups. And this is despite having the lower rate of cancer when compared to white people, like I previously mentioned. And when we look at specific cancer types, we find that Black people have the highest mortality rates for most leading cancer types, including colon and rectum cancer, breast cancer, and prostate cancer. So in 2018, Black people remained at a higher risk of dying from colon and rectum and prostate cancer compared to white people, despite declines in the death rates and narrow disparity between 2013 and 2018. The gap in breast cancer mortality rates between Black and white people remained largely stable in those years, while the gap in lung cancer mortality rates was largely eliminated, and Black and white people ended up having similar death rates in 2018. In addition to these disparities in cancer incidence and mortality, we also find that the overall rate of cancer screening is lower among Black people when compared to white people. However, cancer screening patterns differ by the type of screening. And so for some types of screening, Black people are more likely than white people to be up to date on screening. Despite mixed findings regarding cancer screening disparities, the research suggests that Black people receive later stage diagnoses for some types of cancer, as well as delays and unmet needs in care and treatment when compared to white people. So in general, Black people had the lowest rates of local early stage cancer and the highest rates of distant late stage cancer compared to other racial and ethnic groups at the time of diagnosis. The research also shows that across multiple tumor types, Black patients present with higher grade and more aggressive disease. And they are also more likely to have cancer subtypes that are associated with worse outcomes. The disparities in the stage of diagnosis may be further exacerbated by the decreases and delays in cancer screening that we're seeing due to the COVID-19 pandemic. We also find racial disparities in cancer care and treatment, particularly for diagnostic and treatment delays, which contribute to worse survival outcomes. So the data suggests that Black patients are less likely than white patients to receive stage appropriate treatment or guideline concordant care across multiple types of invasive cancers. For breast and gynecological cancer, Black women are less likely than white women to receive certain evidence-based workup procedures or guideline recommended treatments. And also when compared to white women with similar treatment plans, Black women more often have delays in breast cancer treatment initiation. People of color are also more likely to report unmet needs for cancer care, including supportive care, such as information about the disease, psychological support, pain management, and treatment of side effects. The research finds that US-born Black people are more likely to perceive an unmet need in cancer care when compared to US-born white people. And so given where we are today regarding disparities in cancer incidence, deaths, treatment, and care, continued efforts both within and beyond the healthcare system will be important to reduce ongoing racial disparities in cancer. Within the healthcare system, this can include efforts to reduce gaps in health insurance and other barriers as a means to increase access to care, as well as working to address and eliminate discrimination and bias in care and treatment delivery, while also enhancing providers' ability to provide linguistically and culturally appropriate care to their patients. Also, increasing diversity in the healthcare workforce to ensure that cancer clinical trials and screening guidelines reflect and represent diverse experiences will be important for addressing disparities and ensuring that all people benefit from continued advancements in cancer care and treatment. And beyond the healthcare system, addressing broader social and economic factors, including exposure to environmental risks and disparities in behavioral risks, will also be important to ensure that we all have the opportunity to lead full and healthy lives. And with that, I'll turn it back to Dr. Jeffries Leonard.
Thank you so much, Ms. Hill. So you've given us a lot of things to think about. You've kind of shown us that we have made some headway, but while we have closed some gaps, we of African descent still have a lot of disparities. There's still a lot of inequities, and we're still being disproportionately impacted by certain cancers. I think that is a great opening for our Dr. Brown to come in and talk a little bit about some of the data that we just saw and how this impacts us as not only a people of African descent, but women of African descent. And in addition to the cancers that Ms. Hill talked about, what else do we need to be focused on?
Thank you so much, Dr. Jeffries Leonard, and thank you, Ms. Hill, for that incredible presentation and the data. And I also want to just say how honored I am to be joining this incredible group today, and to thank Congressman Richmond and the Office of Public Engagement for this really, really critical session on cancer in Black people. So I am a gynecologic oncologist, which means I'm a surgeon who takes care of the cancers that affect women, that affect only women, really other than breast cancer. So we also fondly call those cancers below the belt, right? And I want to focus on the major cancer below the belt that we as GYN oncologists take care of, which is endometrial or uterine cancer, because it is one that I think covers and addresses a lot of the issues that Ms. Hill brought up, which are some of the disparities or differences in outcome are due to things like later stage at diagnosis and access to care and access to insurance coverage. But there are some cancers, including endometrial cancer, where that doesn't explain the, lack of care or access to care doesn't explain the whole story. And for endometrial cancer, for the last 40 years, Black women have had a 25% lower 5-year survival than white women in the United States. Now that 40 years spans some incredible advances in terms of understanding cancer, treating cancer, diagnosing cancer earlier. And despite that, we still see this incredible gap. And what we've learned by doing the research and studying endometrial cancer in Black women is that Black women are more likely to get aggressive types of endometrial cancer. And these aggressive types, even though they may be found in an early stage, may not respond to the standard treatments. Now, there's really good news, though, because we've also learned and developed some treatments that can be used against these aggressive types. But we need to know, and we need more Black women to participate in clinical trials for these types of therapies. And we also need Black women to know about their risk for this disease, that they are at higher risk. Black women are about the rate of endometrial cancer is going up. Actually, it's an epidemic in this country. The rate is increasing. And Black women, the rate of getting endometrial cancer is rising twice as fast as it is compared to white women in the United States. And Black women are twice as likely to succumb or to die from endometrial cancer than white women. So these are really alarming statistics. But there is something that Black women themselves can do about it. And that is really being their own advocates for their health and knowing that the main symptom for endometrial cancer is bleeding, abnormal bleeding. And that can be bleeding even if you're still getting your menstrual period, if you have a heavy period, if you have bleeding in between periods or changes in your cycle. And certainly if you stop getting your periods and you have bleeding, that is a signal, and endometrial cancer is something that has to come to your mind. And what you can do is be your own advocate. What you can do is say to your healthcare provider, your nurse practitioner, your doctor, say, I know that Black women are more likely to get and die from endometrial cancer, and I have this abnormal bleeding, and I want it to get investigated. I want to make sure I don't have endometrial cancer, because there's a very easy way to do that. That's to get a biopsy. It's a very inexpensive test, and it will answer that question. So being your own advocate and knowing about the symptoms is very important. But it's also very important for cancers like colon cancer, which is another cancer below the belt that Black women suffer from. It's important that when there are cancers where you can get a screening test to find that cancer early and it can do something about it, that's really important to do. And the screening test for colorectal cancer, the best screening test is a colonoscopy, which is a procedure that a lot of people don't like to do the prep for. They think it's inconvenient, et cetera, but it's really worth it, because if you get a colonoscopy or you do the other colorectal cancer screenings, you can find a precancerous condition called a polyp and remove it. And many people in the audience are probably familiar about colorectal cancer because we lost an incredible talent in our community, Chadwick Boseman, to colorectal cancer at a very young age. And that brings up another really important point, which is family history and genetics. We've learned so much about cancer in the last 10 years, and that it's related to the DNA that you may carry, that you may have inherited from your parents and your family. You may have inherited certain types of genes that predispose you to being at a greater risk of getting both colon cancer and endometrial cancer. Those two cancers go together. Those two cancers below the belt, they're at higher risk for Black people, more likely to die and have these disparities. But the good news is that for both of them, they can be screened for and diagnosed early and cured. But knowing your family history, if you have a family history of colon cancer, of uterine cancer, these are things that you have to ask about and bring up to your healthcare provider. The other thing I wanted to touch on is the issue of clinical trials and how important it is in terms of Black people being able to get the most high quality, latest advancements, best treatment possible. Participating in a clinical trial is a great way to do that. And we know that our community in particular, among other communities in this country and around the world, have well-founded mistrust of the healthcare system because of past experiences with science and experimentation, including the Tuskegee experience. But that is far in the past. And everybody who has cancer, one thing that anyone who's had cancer, has a family member with cancer will tell you, you want the best no matter what. And we need to take advantage of the community. As a community, we need not to be so mistrustful that we don't take advantage of the incredible advances. So in endometrial cancer, we have learned that there are certain types of endometrial cancer that have certain alterations in the DNA of the cancer that make that cancer more susceptible to what's called targeted treatment or immunotherapy, a way of killing the cancer cells that's different than regular chemotherapy and can be extremely effective. But if Black people don't get the tests necessary, if they don't participate in the clinical trials to understand the genomic makeup that they may be carrying themselves or that their cancer may be carrying, they won't be able to take advantage of these great advances. So I believe, and what we advocate for in the community, knowledge is power. The more you can know about your cancer, the more you know about your family history, the more empowered you are to take advantage of the incredible advances that have been made in research and discovery in the last several years. So I think it's really about, knowing your own body. For women especially, we know, I have to bring up that, in the setting of OBGYN and GYN cancers, Black women in this country suffer from the fact that many of their symptoms and their complaints related to their reproductive tract are minimized, are discounted. There is a lot of history going back about this. And when we talk about something where the symptom is bleeding or pain, we know that Black women may suffer from, when they have these complaints, they're minimized. And that's why I say you have to be an advocate for yourself. You have to be aware and really speak up. So I think in these are some of the things I would like to leave the audience with, that are things that you can do. And also to know, and we're going to hear, I think next from our incredible groundbreaking administrator, who's responsible for everyone having access to great health insurance with her work on the Affordable Care Act. But we're going to hear about, how that access can really make a difference for you. So with that, I will go back to Dr. Jeffries Leonard, and really looking forward to what Administrator Brooks LaSure is going to share with us.
Thank you so much, Dr. Brown. You have given us a lot to think about and a lot to be able to move and act on. And you're right, it is time to hear from our groundbreaking, historic Administrator Brooks LaSure. I mean, I know that this has to be a full circle moment for you at this time. We are giving you big applauses because you are our history maker, our herstory right now. But in addition to everything that you've done to lead up to this point, and I want you to talk about how important access is, I know you have a story too.
I do. And Dr. Jeffries Leonard, when you started with saying just how personal cancer is to all of us, it is. We are all affected by this. And one of the things that we at CMS really try to do is make sure we are bringing in lived experience. Almost 15 years ago, my mother was diagnosed with breast cancer. They caught it so early. And, she had a mammogram. They saw something that was little questionable. And, but they said, I don't think this is anything, but come back for a biopsy. And her friend said to her, if I had heard that, I wouldn't have gone, but she went, thank goodness, praise God. And she has been cancer free after getting treatment, and so grateful that she has health insurance, and that she was able to detect it so early. It was barely even what they call stage 1. And when you were talking, Dr. Brown, I was, so this week I did my mammograms and had a colonoscopy yesterday. And no, it wasn't the most pleasant experience, but I have a family history of colon cancer and I am over the age of 45. And they suggest if you're over the age of 45 and have family history, you go and get that done. And, you know, I have a young child and I feel like it is my responsibility to make sure that I am around. And I think that it is so critical that we in our community, just as the distinguished panelists have talked about, really make sure that we are advocating for ourselves. And, you know, I think that when we think about health coverage, it is necessary, not sufficient, but it is so necessary to address any of the inequities that are in our healthcare, that are in our system. It's the baseline to be able to live a life, to get educated, to care for your parents. It's just so core. And one of the things that it's our responsibility at CMS, we have 150 million lives that we're responsible for the health insurance between Medicare, Medicaid and CHIP, and ACA marketplace coverage. And under the ACA, so much more coverage is available to people in terms of preventive services and screenings. And these are the things that we need to do in our community to make sure that we are finding out things early, getting the treatments that are available to us. And so that's really been at the cornerstone of the work since I had the pleasure and privilege of joining the Biden-Harris administration. We're at record numbers in terms of enrollment in our programs, and it's been a real priority in over the last year to make sure that communities of color in particular are enrolled in our programs and made aware. And we are only going to be digging even deeper in 2022 to continue to build on those gains. But coverage is necessary, not sufficient. So it's ensuring access. And we are very focused on making sure that there is sufficient access in our healthcare coverage programs. So that's everything from in the Medicaid program, released an access request for comments to really hear from the communities about how Medicaid treatments across the board, access to providers, and in Medicare, which is the largest payer for cancer in the U.S., we are doubling down. So already, of course, Medicare covers a lot of treatments, but we're particularly focused in making sure that we are covering the groundbreaking genetic and genomic testing that has become available. One of the things, as I mentioned, we are really focused on working with stakeholders and really want to engage the industry and advocates in terms of making sure that people have access to these groundbreaking technologies. And we're really in the process of reviewing our regulatory processes to make sure that people have access to the care that is coming online, because there are such groundbreaking treatments. We also, in our Innovation Center, have been really focusing on innovative ways to make sure that we are treating patients and people. And oncology is one area of real focus, of making sure that we ensure that there is person-centered care and patient-centered care, which to us means making sure the healthcare system is looking at the person and seeing what those needs are. So really focused on access to providers, 24/7, better coordinating care, and we'll be continuing to increase our lens of health equity on all of that work. And so as part of all of the work we're doing, all of the decisions we're making, we're really looking to ask ourselves the question, have we focused on health equity? Is our action, whether it's a policy decision or an operational decision, is it improving health equity? And if not, why not? What do we need to change to make sure that happens? So that's our part that we are engaged in. And as I said, welcome voices from the community. And the other piece is, of course, making sure we all as individuals are seeking access to the care that we deserve.
Thank you so much, Administrator. I know that all of us watching and on this panel are going to continue to do our part to ensure that we move your message of access. So I want to just thank this dynamic panel again for laying the groundwork for the state of cancer that has color and gender, for Ms. Hill doing that for us, for Dr. Brown, really giving us the details on how we need to advocate for ourselves, what we need to look for, and those cancers that we need to be aware of, and the importance of clinical trials. And Administrator, thank you again for not only standing on that wall to ensure that we all have access, but allow us to help reduce the inequities that we see. I want to thank Congressman Richmond and the Office of Public Engagement for allowing us to come and join this panel today for Cancer in Color. Thank you all.
Thank you.
Thank you.
I want to thank Congressman Richmond and the White House Office of Public Engagement for hosting this critical forum. Thank you for having me here today and letting me share my story. It's an honor to speak alongside so many others who understand these challenges in a really personal way. I'm a cancer survivor, full stop. Unfortunately, there are far too many people, especially in communities of color, who don't get the opportunity to celebrate that victory. I first found out that I had cancer really by a fluke. I did my regular checkups, maybe a little less frequently than I probably should have, but in this case, I ended up having to go to my doctor because of a crazy reason. I'd been working for then Vice President, now President Biden, and I hadn't been able to spend as much time with my kids as I would have liked during those years. It was over Thanksgiving 2014, and I was home for a few days of really focused time with my family. The kids wanted to get horsey rides, and even though they were getting a little old for it, I was feeling particularly guilty about not having seen them that much in the days prior. So I ended up saying yes. So I got down on my hands and knees and they climbed up on my back and I went around the living room pretending to buck them. Of course, since they were a bit too big for this, I ended up hurting my neck and back. I didn't think too much of it at the time. I figured it'll go away in a day or two. But when it didn't, I went to the doctor. The doctor said, well, you might have pinched a nerve. It could take a little while to recover. I did rehab and gave it rest, but it just wasn't getting any better. So my doctor had me get an MRI of my neck and upper back. And I did the MRI. And then the doctor called me and said, it's very strange. You definitely have a pinched nerve, but we're also seeing something at the top of the MRI that, something in your nasal passage. They told me it looked like there was some type of growth or tumor. So I went back in. They scoped me to take a closer look, and on Cinco de Mayo of 2015, I received that dreaded call from my doctor. They told me that the growth was malignant. It was cancerous, and they needed me to come in as soon as possible to get it removed and to begin treatment. In a way, my kids are the reason that I'm here today. It ended up that growth was the very early stage of multiple myeloma. It was just one tumor, and it luckily hadn't entered my bloodstream, but if they hadn't caught it when they did, it might have been too late when they actually did. When I first started my treatments, I had to tell then Vice President Biden what was going on. This is while he was coping with the same issues in his own family, since his son, Beau, as we all know, who he loved and all of us loved and adored, was also going through cancer treatment at that very same time. It was a difficult spring and summer for all of us. Unfortunately, Beau didn't recover, while I had the good fortune of actually recovering. The president and I had this shared experience of having such an up-close experience with cancer and how it impacts our lives. Fortunately for me, I had great doctors. I had a supportive family. I had a boss, President Biden, who gave me the space and support I needed. I had good health care, and I was financially stable. Unfortunately, for too many people of color, especially in the African American community, there isn't access to the care that we need or the financial and family support. And even when the care is available, we don't always go to the doctor, get the checkups, or take preventative steps. We don't eat the way that we should or focus on exercise and caring for ourselves. Given our crazy work hours back then, I certainly wasn't doing that. For a lot of folks, the diet, the lifestyle, the inadequate access to healthcare, it all adds up. For people of color, particularly African Americans, it's especially hard because you don't get diagnosed until the cancer is too far along. And it's so hard to recover at that point, especially if you don't have all the support systems that I did. The thing that I'll never forget, and I'll always appreciate and value about our current president, is that he was being put through the ringer dealing with Bo while he had the weight of the world on his shoulders as vice president. But when I told him about my diagnosis, even though he was a little bit stunned when I first told him, he was able to put all that was going on in his day and his life aside to stop thinking about all that other stuff that I know was on his mind and to focus on me. He said, "Don, what can I do for you? Is there anything that you need?" He told me to take the time I needed to take care of myself, that was the most important thing to him. I'll never forget that. Right after I told him, he got in his car and he had to actually go and see Bo. But for him to put everything aside and respond to what I was telling him and to focus on me, that's just so emblematic of who he is as a person and as a leader. That's why it's so important that President Biden is relaunching the Cancer Moonshot. That's what this is all about, frankly. We need to make sure that we're asking our friends, our family members, our coworkers to take preventative steps now. And if they're diagnosed, we need to ask, what can we do for them? I'm humbled to be a part of this administration, which has set new goals to decrease the cancer death rate by 50% over the next 25 years, and to improve the experience of people and their families living with and surviving cancer. I know that President Biden, like me, is personally invested in this, and I'm grateful to be speaking with you today about my experience and what this administration is committed to do, not only to fight cancer, but to promote equitable care for people of color. I'm one of the lucky ones, but the president and the relaunched Cancer Moonshot will make sure that it no longer requires luck to overcome cancer. Thank you.
Thank you so much, Deputy Secretary Donald Graves, for joining us. My name is Carissa Smith. I serve as a senior advisor here in the Office of Public Engagement, and I'm so excited to introduce our last and final fireside chat for today. We are really thrilled to have these next voices coming up before you. Our next fireside chat is titled Black Men in Cancer Prevention, How to Care, and it will be moderated by our very own Dr. Alistair Martin, who is our White House Health Policy Fellow. Currently, Dr. Martin is a practicing ER physician and former chief resident at Massachusetts General Hospital. He's on a sabbatical from Harvard, where he's duly appointed as an assistant professor at Harvard Medical School and as a research faculty at the Harvard Kennedy School. He currently works in our office here at the White House Office of Public Engagement and currently serves the Office of the Vice President. So without further ado, I'm going to turn it over to Dr. Alistair Martin for this critical conversation, and with a very special voice and leader and advocate that will be joining him. Thank you.
Thank you very much, Carissa. And thank you, Drs. Leonard and Brown, Latoya Hill, Administrator Brooks LaShore, and particularly Deputy Secretary of Commerce Donald Graves for that incredible testimony on the importance of Black men in screening and wellness. We're going to shift gears and turn the spotlight onto the fellas here with our fireside chat today on Black men in screening and wellness in the Black community. And as Carissa mentioned, I'm an ER physician and a part of the team here in the White House Office of Public Engagement. I am so honored to be able to introduce to you all our special guest for this fireside chat, one of the most accomplished NBA and college players of his generation, prostate cancer advocate, Hall of Famer, lead analyst for Turner Sports CBS, and that's Grant Hill. Grant was a 7-time NBA All-Star, 2-time NBA champion, and successfully made the transition from 19 years as a professional athlete to leadership in business and the nonprofit sectors, along with several television broadcasting roles. But today, we are here to talk about another issue that is near and dear to his heart, and that is about Black men in cancer prevention. Now, as a physician, I've seen the ravages that prostate cancer has inflicted on the Black men that I've treated. They typically come in later stage in the ER. They're more likely to present to the ER with metastatic disease once the cancer has spread to the bones, the lungs, or the brain. And too often, far too often, the calls are not to the oncologist to help get my Black male patients into treatment. Far too often, the calls are to palliative care to help folks who have disease that is too late to treat deal with the end of life. So professionally, this is something I'm directly engaged with and fought in my role as a physician, but also personally, this has affected me. My father passed away from prostate cancer that went untreated. Had he acted sooner, he might have still have been here. It was too late for him, but it's not too late for our community to do what we need to do to keep ourselves happy, healthy, and whole. So Grant, your work has special significance to me, and I'm grateful for the work you do. And that's where we'll start, Grant. Why did you decide to use your platform to discuss Black men and prostate cancer screenings?
Yes, well, first of all, I'm very honored and thrilled to be a part of this incredibly important conversation and discussion. And for me, obviously we know, we all have been impacted in some form or fashion with a loved one, a family member, friends, colleagues who have been impacted by cancer, and in particular prostate cancer. And for me, I was a former athlete. My most 20 years of my adult life went through a difficult time about 20 years ago, where I had a number of ankle injuries. And I feel as though I didn't really get healthy until I took ownership of my health as it related to my ankle. And, I learned the importance of taking ownership for oneself. And I did that so I could return to play, but also that I could, play at a high level against some of the best athletes in the world. And so that experience taught me that, we all should advocate for ourselves, and particularly African-American men. Prostate cancer obviously is a risk for all men, but it disproportionately impacts African-American men. And when I found out that African-American men are twice as likely to be diagnosed with and 2.5 times more likely to die from prostate cancer than Caucasian men, I realized, wow, okay, I got to get off the sidelines, if you will, and get in the game. And so, yes, this disparity is definitely, very unfortunate, but felt compelled ultimately to, try to do my part to educate and inform African-American men, about this burden of prostate cancer, but also how it can be treated, how it can be prevented. And we just, we have to educate, we have to inform, and we have to take action. And as I said, as I said earlier, we have to be willing to take ownership for our health.
Thank you so much for sharing that. And particularly the piece that resonates with me is this piece of getting off the sidelines and getting in the game. And I feel like as Black men, often we have this hesitancy, this sort of reluctance to kind of really get in the game on this issue and to deal with it head on. And, Grant, many folks don't know that if caught early, survival rates for prostate cancer approach 99%, right? Which is why it's so imperative to focus on how we as Black men discuss health and wellness. And so, what comes to mind for me and what I'd love to get your perspective on, Grant, is, what ways are you using advocacy to make a difference in how Black men discuss health and wellness?
Well, I think you're spot on. I think, culturally, we as Black men, there's a lack of trust with the idea of going to a doctor, particularly when there's nothing wrong or doesn't appear to be anything wrong.
Right.
And, I think that is something that we need to desperately change. And as you said, in most cases, in the majority of the cases, when found early, it can be treatable. And so, one of the things, obviously, talking about it, using sort of my platform to bring awareness, to share that message that you talked about, and what I just mentioned, is one of those ways. But I've also teamed up with a pharmaceutical company, Dendreon Pharmaceuticals, and we've started a campaign, a Start Strong campaign, and that is to raise the awareness of the various racial disparities as it relates to prostate cancer. But more importantly, to encourage, African American men to be proactive, to go and get screened, but also those men who are living with prostate cancer to develop a game plan, to develop a treatment plan as it relates, to their care. And so there's certainly, new treatments. Immunotherapy is one of them, which will help, and it certainly has had great results, particularly with African American men. And so, that's what I'm, trying to do, and at least trying to stress the importance of that. But look, I mean, I think, going to the doctor, and particularly this, this kind of screening, I think, it's somewhat taboo, and
Right,
Black
right.
males are not not accepting or willing. But even then, the screenings have changed, and it's not sort of what we think of the screening in some ways in years past. And so ultimately, it's just it's educating, it's informing, and having these type of discussions, having these type of forums, listening to the doctors, sharing and exchanging information, and really working together in collaboration to change that narrative about the disparities that exist in our community.
I love the way that you frame that, Grant, because, it's not just the duty and responsibility of the government, right? All sectors have to sort of come on for an all hands on deck approach. You mentioned industry, the nonprofit sector, et cetera. And as you know, Grant, the president reignited the Cancer Moonshot, which is going to build on a quarter century of bipartisan support, public health progress, and scientific advances by doing three things: mobilizing the whole of government approach to ending cancer as we know it, issuing a call to action on screening and early detection, and forming a cancer cabinet to bring together departments and agencies across government to address cancer on multiple fronts, right? Again, this whole of government approach to tackling cancer. And as you know, Grant, as part of this effort, the president recently called on multiple industries to step up and take action on preventative care for cancer patients. So, you've given us a really clear example on Dendron, and I'm wondering, what are the other ways you think industries should support equitable cancer care, especially for communities of color? What more can industry do to really step up in some of the ways you've described?
Yes, well, I think it's critical, it's crucial that industries, all industries, are proactive, particularly when it comes to to preventative and equitable care for our communities of color. And really, this means spreading awareness, providing resources to ultimately educate and inform our communities about all of the various treatment options that are helping cancer patients live longer, or what can be done to prevent or cancer from happening, or treating it earlier. And so I think there's a huge responsibility, and I think to challenge these industries, but also to work in collaboration is necessary. It's going to take a team effort, and forgive me for my sports references, but together as we work as a team, we can fight that. We can change this, and we can, we talk about Black Lives Matter, and that's something that over the last few years has been at the forefront of all of our conversations. And well, to me, our health is a integral part of that for obvious reasons. And so not only as Black men do we need to be proactive, but we need to challenge all industries, the medical community, the corporate community, to really help with, if you're committed to Black Lives Matter, then I think this is certainly in line with what that's all about in more ways than one. So it's a team effort. It's going to take working in the spirit of collaboration. But I believe that we can we can make a difference, and so, I think it's about not sitting on the sidelines, but being proactive, and particularly when it comes to your health, when it comes to our health and our wellness journey. And so I'm excited to be on this journey, and certainly challenging our community, but also those that benefit and serve our community to take this journey with us.
No, Grant, I resonate with the statement, about this being a team effort. This is going to take all of us, getting off the sidelines as you've described to really do this. And I want to just pause for a second and thank you personally for your time, for your commitment to the issue, for caring about this issue. As I mentioned, this is an issue I care about deeply professionally, and also one that has affected me personally. So thank you from the deepest part of my heart. I know there's a million things, Grant, you could be doing with your time, but you chose to really sort of take up the mantle with this. And we are going to be a better nation because of it, and we are going to be a healthier people because of it. Thank you very, very much, Grant.
Thank you. It was an honor.
I'm going to hand it back over to my incredible colleague here at the White House, Carissa Smith.
Thank you so much, Dr. Alistair Martin and Mr. Grant Hill. That was an amazing fireside chat, just focusing on the unique inequities that Black men face when it comes to cancer, but also just talking about wellness and health is directly tied to screenings, tied to regular checkups, and what that means. Firstly, I just want to say thank you to all of our amazing voices and advocates who joined us here today. Today would not have been possible without all of you. We are focused on cancer in color and what does equitable care mean for our communities here at the White House and across the administration. So thank you for tuning in today. You can find out more information actually about the White House Cancer Moonshot Initiative simply by going to whitehouse.gov/cancer moonshot. That is whitehouse.gov/cancer moonshot. Thank you all and have a blessed day.